Without further ado, I'm going to pass it on to Fritz. Fritz is a clinical site manager. He works for Wits Health Consortium in Johannesburg. He has 11 years experience in managing international clinical trials and is the lead of the ISO 15189-2012 auditor. He's also a good clinical practice trainer, GCLP trainer. So without further ado, I'll pass it over to Fritz for his presentation. Fritz, you have the floor.
Thank you very much, John, and hello to everyone. Just going to share my screen now. Okay, good afternoon, everyone. I'm just going to give you a short presentation and working towards accreditation. The idea is not to be able to do accreditation tomorrow. It's a long process. So the objective here is to try and differentiate between what is a license, what is certification, and what is really accreditation. We're going to talk a little bit about the accreditation process, and then SLIMTA and SLAMTA, which is what the WHO has put up for the African region in terms of working towards accreditation. So the international accreditation for medical laboratories is a really complex process, but the WHO has split it down into the SLAMTA and SLIMTA checklist that helps us go through the process. And we'll just give a few benefits about accreditation. I want to start off with putting up a scenario. Think of it as, say, if you were working in the Ministry of Health, or if you're a laboratory manager and the minister came to you and said, we're having problems with people accepting the results that we give them. What would you put in place to ensure that our results are accepted locally and internationally? As we know, laboratories are factories that produce results, and this needs to be actionable results. They need to be useful results, whether we're doing, whether we're in research or in clinical trials. The results that we produce need to be useful. So the minister asks you, what do we need to do? An easy way would be, one way would be to say, we are running a laboratory that has a license, or we have certification, or we have accreditation. So what does this all mean to have a license? The simplest way to get your results accepted is to have an evaluation done by an independent body that shows that the results that we're producing are accurate and they are reproducible. In research, when you publish an article, it goes out there in the world and people take it and say, I found this new cure for cancer. Can somebody else reproduce the results? We've produced results in Ghana, say in Kintampo. Can somebody in New York take the same experiments that we've run and done and do the same thing and get the same result? The other way is that, do we comply to international standards? When we say we've run an experiment or we've done this clinical trial, does it comply to the international standards? And we have a quality management system with the 12 quality management essentials that we have to put in place to ensure that we are complying with international standards. So what's a license? A license is simply a document that is given to, say, a laboratory or to an individual to practice. So if I'm a biomedical scientist, say in Ghana, we have something in Ghana called the Ghana Association of Medical Laboratory Scientists that needs to give me a license. In South Africa, they have the Health Professions Council. To practice, you need one of those documents. If you don't have a license, then you can't practice. But having a license is not accreditation. It's simply a legal document given by the government or a statutory body that says you can practice. One thing I wanted to say earlier is, when we talk about accreditation, please think about, say, a car. Think about a car needs to be on the road. But in order for a car to be in the road, in countries like the United Kingdom, you need something called MOT, which is Ministry of Transport. You need to take your car in and it needs to be checked to see that it's roadworthy. In South Africa, you need something called a roadworthy certificate. So as we talk about accreditation, think about it as an MOT pass. We'll define it a little bit more, but think about what we're doing. A car needs a car registration, which is similar to a license. It needs to be registered to be on the roads in this country. We can drive across the borders in Africa, You can drive from Ghana to Nigeria. You can drive right off the way to the Gambia. But in order to drive on public roads, the car needs to be registered. It needs to have a number. So a license is just the same as registering the car and having a number. It does not say that the car is roadworthy or we're competent to drive the car on the road. It simply says that it's been registered. So as a professional, I need to be registered. As a laboratory producing results that affects people's lives, I need to be registered. So a license is simply a legal requirement that is given by a government agency to say that in this geography, I can practice. And what is certification? Certification simply shows that what we're doing or a product meets certain standards, conforms to certain specific requirements. So if I'm producing cars, does the car have four wheels? So cars need to have four wheels, or if they're bigger cars, they need to have certain things. So a certification simply says that we can do this thing. So you have a driver's license or something. Well, a driver's license is more similar to accreditation because you need competence, but a certification simply says that we can produce something that meets specific standards. In terms of a laboratory, we're producing laboratories using laboratory results using SOPs. So we're conforming to the requirements to produce the results. And what is accreditation and how does accreditation differ from certification? Accreditation is a procedure which an authoritative body looks at what we're doing and say we're not only meeting the requirements, but we are competent. Competency, so think of a certificate as I go to university or I go to school, I come out with a certificate. I've passed the exam. The certificate says I've got this qualification. But if I come to your lab, you don't know whether I can produce a hematology result. I've come out of the university, I've got a piece of paper that says I can produce results. But how do we know? In order to know that, you need to test me. You give me a simple test. And if I pass that test, you say I'm competent. If you take 10 unknown microbiology samples and you give it to me and I identify all 10 of them, I'm competent to perform that assay. If you take 10 unknown chemistry samples, you can use EQA samples. If you give them to me based on how you've defined competency in your lab, and you tell me that if I can do those things, you say I'm competent. So accreditation says that we are meeting the requirements, but we're also competent. They have tested us and this laboratory is competent to do what it says it's doing. So accreditation provides a higher level of confidence, assurance that the results that we're producing are accurate and reproducible. So if the minister came to you and said, what would you make sure that the results we are producing in Cameroon are meeting international standards? You make sure that we have a certificate that says that we're meeting the requirements and producing the results. And if we have accreditation, then we are competent to do what we say we're doing. You need that in clinical trials. I have an image here of a SANA certificate for a laboratory in South Africa, and it specifies exactly what we're supposed to do. We are competent in microbiology, in molecular assays, in chemistry. There's a limited, not limited, you need to be tested on each assay. So whereas a certificate says you meet all these requirements for accreditation, it will specify exactly what assays you can do. And we've talked about the fact that it needs to be done by a body that meets those, a qualified body. It's not everybody that can do this. We have different organizations, and in order to do an accreditation, you require the accreditation body. I think in South Africa, we have SANAs. In Southern Africa, that covers most of South Africa, Zimbabwe, right, Zambia to Tanzania, you have SADCAs. SANAs used to do for most of the other countries, but I think about 5 or 6 years ago, that was moved over to the Southern African accreditation system, which is SADCAs. You require the actual standards. What standards are we looking at? For most medical laboratories, the standard is ISO 15189, the last edition being the 2012 one. You require assessors and you require an actual laboratory. if you're a medical laboratory, you require the ISO 15189. For testing and calibration laboratories is the ISO 17025. And the standards are produced by the biggest organization, the International Organization for Standardization. They developed the standards. You would know that the ISO 15189 is derived from ISO 9001, which is a quality management system, and we take our medical section from it. And those standards are applicable to, the standards that ISO produce are applicable to many different organizations, including clinical laboratories, medical laboratories, and public health laboratories that produce medical, actionable medical results. In Africa, we have a lot of laboratories, and some of you work in some of those laboratories in public health. You would see that I've been doing this work for about 11 years. We started off auditing public health laboratories for clinical trials to bring them in so that could produce results for clinical trials. And you would see that a lot of them didn't have a specific standard. And you walk into a laboratory that has been doing malaria microscopy for 20, 50 years, and you would not even be able to get an idea of what kind of results we're producing, because the result is either a 0, a +1, a +2, a +3, or a +4. That's how parasitemia is measured. And in clinical trials, you want to have an accurate result, or in medical practice, you want an accurate result, because I can walk in and say it's a +1, and John will have a look at it, or Jean-Paul will have a look at it, and John would say it's a +2, and Jean-Paul would say it's a +4. So those kind of subjective results are not really accurate. And the WHO put in the system the stepwise laboratory improvement process towards accreditation, which helps a lot of laboratories in Africa get accreditation. And they start from 1 star to 5 star. A 5 star, you're ready for accreditation. A 1 star, you still need a lot of improvement. I wanted to put up different images of what the system is like, but it has different steps, as I will show here. This is the management process. We have 4 different phases and what we need to do in each phase to get us ready for accreditation. But overall, what we're trying to do is there's a score that we need to get, and it's about 258. If you get, you've reached a 5 star, and you can proceed to accreditation. But the system is broken down into the different phases. In phase 1, we create a commitment to quality. So we're not simply saying that we produce results. We want to ensure that we're producing results that are both accurate and reproducible. And we have to ensure that we have a competent personnel to do this. One very important word for accreditation that if we take away from this discussion, I know a lot of the labs are accredited and many people have experience with accreditation. The one word in accreditation is really competent, competency, where we really measure that the lab or the individual is competent to do what they say they're doing. I put up a few activities here, organization activities that need to be done in terms of the 12 quality management essentials. In terms of organization, in phase 1, we need to have a quality management team. So in phase 1, we appoint a team that says, we've made a commitment towards quality, and this is the team that is going to prepare us for accreditation. It's going to work on this laboratory improvement process. What are the things that we need to improve? We need to improve the organization. And the first part is setting up the quality management team with a focal person for quality that takes responsibility for the team. We need to make an action plan. We set out our goals. What are our goals in terms of the personnel in phase, when we're doing this improvement? What are our goals in terms of the equipment? What are the goals in terms of purchase and inventory? And when we set out those goals, they need to be SMART goals, which means they're specific. So if we say that we're going to run hematology, we need to be specific what type of equipment we're going to buy and purchase, and when should it be purchased. If we say we're going to manage the inventory in this way, what kind of inventory system are we going to buy? Someone talked earlier about a LIMS system. If we're going to implement a laboratory information system, what kind is it going to be? When are we going to have it, and how are we going to validate it to make sure that it's doing exactly what it's supposed to do? So everything needs to be competent. A LIMS system needs to be competent, and we need to show that it's competent. What we put in should be what we get out. So when you validate a LIMS system, all the inputs needs to be exactly the same as outputs. It needs to be secure, only authorized people can use it. The next thing we do in phase 1 is organize staff meetings. How are we going to have a staff meeting? It comes through from our quality management, quality manual that says we're going to have a weekly staff meeting to discuss how we're progressing on this laboratory improvement towards accreditation. We appoint a safety officer that is going to look at our different facilities and ensure that they're actually safe, and when we buy equipment and when we bring in people, that they're actually safe. We appoint an equipment officer, stock management officer, and we make an organogram. The organizational chart will show exactly how we relate to each other and how we report to each other and how we look. We review each person's work, because if a task is left in my hands, let's say the task is simply to read malaria slides and give a parasitemia. If the task is only in my hands, then the results depend on me. But if the organogram shows that I report to somebody else who reviews the result, then that can be checked. The next step is phase 2. And there's quite a lot of different things that are in these different phases. They're broken down into, so if you see, we start phase 1, number 1 is quality, a commitment towards quality, and we make sure that we've done that, we made a quality statement. In phase 2, we're starting at number 7, we ensure proper samples for testing. When we say we ensure proper samples for testing, it doesn't mean that we just write a statement down. We will write an SOP for sample rejection, how are samples, sample acceptance and rejection criteria, how are samples going to be accepted in the lab, what type of samples do we want, we're running viral loads, does the samples come to us as whole blood in the EDTA tube, or do we get plasma? Excuse me, we spin down the samples, what we're running hematology, what are the criteria for rejecting samples?
Fritz, just 1 second. Everyone, please turn off your microphones, please.
Thanks, John. So the SLEEPTA program breaks these things down and makes it easy for us to do. You look at number 15, it says we ensure equipment management. What do we do with equipment management? We make sure that each piece of equipment has its own SOP on how we manage the equipment. We have a contract with, say, the supplier for maintenance of the instrument. We have a daily or weekly or maintenance checklist, and we put all of those documents in place in phase 2. In phase 2, there's different personnel activities that we can do. I put this one up especially because competency is really important. So how do we do competency assessment? In phase 2, we need to ensure that all our staff are competently assessed for the different assays that they're doing. So if I'm running hematology, you need the competency SOP, and you need to ensure that everybody running the hematology samples has competency assessment. We need to have an induction program for people that come and work in our lab. So there's a training SOP that specifies what kind of training that is going to take place, what kind of competency assessment is going to be done. When I finished university here in Johannesburg, my first job was at Imperial College in London. And in the first week, about a week and a half, was just going through the induction program. And it goes as detailed as telling you where the toilets are, where the exits in case of a fire. There was a bomb drill. The next part is doing the performance appraisals. What are the criteria you use to do performance appraisals? So moving down from competency, I have a set of tasks that you give me in the lab. So you will give me a job description of what I need to do. I come here, and your induction program will have a job profile for, say, a biomedical scientist, and you will give me a specific job description for me, and then you will develop a performance appraisal on what I should do. So if my job description says I have to run hematology samples, you would say you want no errors in the hematology samples, or you would say you want that the external quality assurance program that we have for hematology, that we need to have 100% pass rate for all the samples that I run. And that will be part of my performance appraisal. So if we come in and I only pass 50% of the time, then you would say, you're not performing up to standard. But it needs to be a clear system that defines what is the expectations. If our commitment to quality in our quality manual says we are a 24-hour lab and my shift starts at 7 o'clock, but I always show up at 10 o'clock, then that goes into my performance appraisal. You have staff files. They are defined documents that you need to have in the staff files. So you create those ones in phase 2. Staff files, in clinical trials, we have confidentiality agreements, we have a CV, we have the formal qualifications, we have the competency assessment and training records, and all the things that you've done here. All of those is compiled in a uniform way for everybody. Not that, if I like your face, you don't do competency assessment. If I don't like your face, this one doesn't do it. But all of these things are required for accreditation, and it needs to be consistent for each person. Then we move on to phase 3. We optimize performance management. We optimize facilities for safety. We run molecular labs. You would have to optimize the way that samples come in. There's a receiving area in terms of the facility, and then they move into a dirty area when we do preparations, when we do viral loads. We make sure that there's a unidirectional flow of samples. We optimize this in phase 3. We optimize support systems, but most importantly, in phase 3, we establish an audit system, an internal audit system that is going to check us. And we normally say that your internal audit should be much stricter. We started off here by saying there's an assessment by an independent body for accreditation. So if we wanted to have accreditation, it's done by a qualified body outside. But in terms of your quality management system, we require a strong audit system that will look at what we're doing. And some of the activities we do in phase 3, so we will determine the turnaround times for our different assays. If we are running hematology and we say that we produce a result in an hour, so we will work through our process and look at how the different assays that we're running for microbiology, for virology, for chemistry, we will determine the normal turnaround times. And we put in useful turnaround times that benefit the people that we're giving results to. So the clinician sends us a sample, we need to give them an ideal turnaround time for the management of patients. So if they send us an HIV rapid sample, we can't say we'll give you a result the next day, when the actual assay takes 15 minutes, or in some cases just 10 minutes to run. Once we've determined that, we need to monitor our adherence to that. So we get 2,000 HIV rapids to run. How did we meet turnaround time? We need to put in a system to monitor our adherence to the turnaround times. We need to have a validation SOP and validate all our processes. When we talk about competence, our processes, we need to show that our processes are competent and meeting our commitment to quality. So whether it's an assay or an instrument that we need to validate, we need to show with objective evidence that it is meeting the requirements and we are competent to do that. So let's say an HIV rapid, we need to demonstrate that each time we run this rapid, if we have one line, it's a negative, and if we had two lines, it's a positive. So we take known positive samples and we take known negative samples and we run them in an assay, whether, whatever HIV rapid kit you're using, it needs to show that what the manufacturer says it does, it's actually doing it. Let's talk a little bit about the audit, because ISO 15189 and 17025 emphasize internal audits. So in order to gain accreditation, we must have an audit program. It could an internal audit, as we mentioned, that we are showing that we comply with the standard. And the people who are doing an audit need to be, in terms of internal audits, I think someone mentioned it today, need to be independent of the activity. So you can't have the head of chemistry, the chemistry department doing an audit for chemistry. In terms of the accreditation, we need to ensure that our internal auditors have been trained and meet the standards to do this kind of audits. Not that if I'm working in chemistry, you just take me and say, okay, because you're not working in microbiology, go and do an audit in microbiology. That's the right thing, but I need to be competent to do that audit. And generally we require that you have people do an internal audit course and to ensure that they know exactly what they're doing. In clinical trials, we normally say that one of the commandments of clinical trials is that if it's not documented, it's not done. So the audits need to be documented properly. We need to retain the audit reports, and we need to ensure that the audits are being communicated to management and addressed properly. So if we are doing audits and not documenting them, the assumption is that they're not being done. If we're doing audits and not communicating to management and they're not taking action to correct the findings that we're having, then it's as good as pointless. So we require quality management audit training. We require a 12-month program. An internal audit needs to have an internal audit schedule. We need to conduct those audits and document them. And we need to always formulate an action plan on how we address them. It's no use finding out that, say, for example, you have a tire puncture or the thread on your tire is very low and doing nothing about it. You're still putting people's lives at risk if you're driving out there with a car with a low tire thread. It's very similar to what we do in the laboratory. There's no point in looking at our data and saying that 60% of the time, our HIV rapid gives us the wrong result. And then we do nothing about it. And then we keep sending out results, but we know for a fact that 60% of the time it's giving us the wrong result. So when you conduct an audit, you need to take proper action. Then we come to phase 4. Sorry. Again, we optimizing our human resources, making sure that our people are properly competent, they can do exactly what they need to do. So if we've arrived at this level and we've done well, we've done our preparation correctly, we just simply putting the final building blocks to our quality management system. If we follow the slipped well, we ensure that we have the staff for every task and that our people can fulfill all the requirements of our quality commitment. We ensure that the procedure for new staff, or what we do with induction, how do new people come. If you work in clinical trials in Africa, you know that people move quite a lot. So somebody gets a new job in Dar es Salaam and they need to move. How do we bring in new staff? What are the educational needs of the people that we have? We need to put in a continuous professional development program that ensures that we retain the best people that we have. And we send our quality management by phase 4, our quality management focal point is now turned into a quality assurance officer. And you need to ensure that the person knows failure mode effect analysis, and so that they can look at the whole system and look at the risk for the system and see where the risks are so that we can mitigate those risks. We always approach quality with Murphy's Law. We think about if something can go wrong, it will go wrong, and we try and put in measures to correct those things. Yeah, so essentially, accreditation is the formal recognition that a testing or calibration laboratory is competent to carry out specific tests or calibrations. So if our minister or our head of hospital came up to us and say, what do we need to do to ensure that our laboratory results are recognized internationally? The point is to go for accreditation. And accreditation shows that we're both competent in the types of tests or calibrations that we're doing. And accreditation, if we follow the system that the WHO has in Africa, sorry, I'm going over quite a bit. If we follow the system that the WHO has put in Africa, we'll arrive at accreditation. Just to mention the different common standards that we use for certification, ISO 9001. The current one now is 2015, ISO 14000 for environmental. Where we are, what we're talking about today is mostly ISO 17025 and 15189 for medical laboratories. Different places have different regulations. And you have CLIA in the USA, but we're not going to go into that because we run out of time. So essentially, I was asked to talk about ISO 17025. It just enables laboratories to demonstrate that they operate competently, they generate valid results and testing collaborations, but it does not cover the safety operations that is covered in 15189. So if your person comes to you, this is what, and you're running a clinical laboratory in public health, this is the standard that you need to go for medical laboratories. Covers the quality management processes, the technical processes, and administrative systems. The process is simply to do an application. There will be an on-site assessment. Deficiencies will be noted, and we'll correct the deficiencies. We'll do proficiency testing, the EQAs that we do, and accreditation is given, and there's an annual assessment and reassessment. It's not, once you've given this certificate of accreditation, it's not a once-off. In some cases, there is annual. So like in the UK, there's an annual MOT check to check that your car is still roadworthy and can still be on the road. It's not producing toxic emissions. We talk a little bit about the benefits of accreditation. There's national recognition and international recognition of the results. There's reduced cost from retesting. If we are going to have to test something because we don't have the correct systems to ensure that we get the right results, we do more and more. We use more reagents, we use more labor, so it's more costly. We have better control over laboratory operations because we've defined everything. Everything follows an SOP. We have increased confidence in testing and calibrations. We have increased profits, if that's what we're looking for. It's the wrong spelling here. Because we're giving out better results. We're serving our community properly, and it improves the health of our communities if we're giving quality results. Thank you.
Thank you, Fritz, for that excellent presentation. We will now move on to the Q&A session. Fritz, myself, and Franklin will be monitoring the questions that you put in the box. We'll read them out to Fritz, and who'll answer your queries. So if everyone can put their questions into the chat box, we will ask, we'll then pass them on to Fritz. Thank you so much. Just to get it started, Fritz, there's a question from Isanye, and the question was, what's the difference between certification and accreditation?
Okay, A certification simply means that we're producing something according to the requirements. And accreditation adds the competence. So we are competent to do it. So there could be, let me think about something easier. So there could be many factories producing t-shirts, but they haven't been tested to show that they're competent to do this. So the certification simply says that you have you're meeting the requirements of any product, and our product is laboratory results. So we've got the SOPs in place, we've got a management system in place, but we have not been tested to show that we are competent to do what we're doing. So that's the main difference. So when we do accreditation, they will come in and take samples of what we're doing. And when I say samples, not an actual sample. They will look at how we're doing it. They will test our systems rigorously to show that they are competent. So the main difference is the word competent.
Thank you, Fritz. So there's a question, apart from, sorry, I'm just starting my video. Apart from SADCAS, can a laboratory get accreditation from abroad, outside Africa?
Yes, I think I have seen, so in Southern Africa, the main bodies are SANAS in South Africa and SADCAS in Southern Africa. But I have seen that some people have gone directly to the College of American Pathologists for accreditation. But those, you need to look at the resources, because accreditation is not cheap. So if you're going to go to the College of American Pathologists to get them to come in and do an assessment, it's more expensive. But yes, you can get from other bodies like the College of American Pathologists. But they're all using the same standards.
We have another question regarding laboratory accreditation, in particular this time when we have COVID outbreaks. The question is, can such an activity be done virtually?
I don't know if I know the exact answer. We've done audits virtually, not audits, but I have seen in our own laboratory recently when the FDA wanted, we run a clinical trial laboratory in Johannesburg, and we run a whole lot of studies, and the FDA wanted some documents from us. They couldn't come out, so they did almost a virtual audit. But I don't think that an accreditation can be done virtually, because it will be, we need to see original documents. Sometimes you have a lot of, let me think of simple documents. In the laboratory, we have something called a signature list that tells us who works here and who's been here for this period of time. And if you give me a virtual one, I actually need to see a wet ink version, but one can be scanned and sent to me to have a look at. But I think it's really difficult to do accreditation virtually. I'm next off to a place called Kasama in Zambia, because we need to be there to see things before we, before a lab is accredited. But I don't have experience of it being done virtually, and I'm not an accreditation body, so I don't know. Maybe if you ask SANAS or SADCAS or College of American or CAP, they might have a different answer.
Thank you for that, Fritz. Yeah, we've had site visits that were virtual site visits in like my experience, where they assessed our laboratory, but that was not an accreditation process. So I think in for purposes of accreditation, an actual like physical visit to the lab might be necessary, because there's some infrastructural things. For example, how's your lab designed? How are your hallways? Like, you know, are all your fire exits, you know, open for people to like head out? All of those things, you know, what materials are you using when your bench tops? Are those like, all of those things like go into like, you know, like process. So some of those things cannot be assessed virtually. So I hope that answers the question.
Yeah.
We have another question talking about standards. So I'm guessing this refers to laboratory equipment, and when you're trying to validate laboratory equipment in your accreditation process. There's a question that is saying standards are expensive to acquire for most African labs. What would be the easiest way to obtain these documents for our settings?
Well, I don't know, but I think the documents, this presentation is mostly based on the WHO documents, which are free. So you can obtain most of this for free. So the WHO Africa region makes a lot of these documents free. In my organization, the Wits Health Consortium, we usually purchase some of the standards for, I mean, we don't have millions of copies, but for the labs that we're running clinical trials in, which is almost all of the continent, we purchase, the standards, well, not all of the standards, but we purchase the ISO 15189 standard for those laboratories. But if you look at the WHO documents, a lot of the SLIPTA and SLAMTA processes are taking, and even some of the language is taken from the actual standard itself, and the WHO makes this free to anyone. Yeah, but if people want to talk to me about it, we have them purchased here, and I don't know whether we're allowed to share them, but we purchase for some of the organizations we work with.
Thank you, Fritz. I would also advise reaching out to other laboratories who are like in the process of accreditation, and also depending on the test, there are various organizations that have biobanks of reference material and standards that you can reach out to if you're trying to get standards for validation of your laboratory equipment.
John, sorry, Fritz, I think there are a couple of questions that I might just summarize. There are a few others that are asking if they have a smaller lab and private lab, what's the cost and how can they benefit like from SLIMTA or getting towards accreditation? We'd just like to know.
Is that Franklin?
Yes, that was Franklin.
Yes, Franklin.
Okay. Yeah. I just wanted to mention that it was interesting that when I looked at the names of the people in this session, it turned out that we are all from Cameroon. So that's Franklin. I'm also from Cameroon. For smaller labs, I'm not sure what they can do, but it's really important that if you're producing results, they need to be credible results. They need to be accurate and reproducible, reliable results. So the accreditation is really important. It looks like a costly thing, but it reduces cost. There's upfront cost. But if you're going to work as a smaller lab, there's a huge amount of that. If you don't have the systems in place, it's going to be in the long run be more expensive. I think about a story I had once where I had a needle stick injury from an HIV positive patient, and taking antiretrovirals was very difficult. And my one colleague said to me, you can choose to take them now or take them later. It's your choice. And it sounded very harsh, but it was very important. You can take the upfront cost of accreditation, or take the eventual high cost of having to work without, quality. But I don't know what the solution for smaller labs is. There's grants for things, and so you can talk to the major funders. If somebody's funding studies running through your lab, you could put the cost of quality into it and go for something, yeah.
Thank you, Chris. So another similar question from the chat is about, apart from SANAS, which is based in South Africa, so countries like Cameroon, Kenya, do they have their own accreditation body? So just why should everyone go to SANAS?
Okay, I'm not sure about the countries like Cameroon and Kenya. SANAS used to do for a lot of countries, but they're not allowed outside South Africa. My understanding is that SANAS is now limited to South Africa, and SADCAS takes over the rest of Southern Africa. But in terms of accreditation, it needs to be a qualified body that does it. So maybe there's a need for in East Africa and in Central Africa for such a body to create such a body. So SADCAS is for the Southern, was formed by the Southern African Development Community. So, and the rest of Africa has such organization. In West Africa, there's ECOWAS, and in Central Africa, there's UDEAC. So those organizations can formulate a body or the Africa CDC as well, and through the African Society for Laboratory Medicine, we can come up with a continent-wide body that makes this easier. I'm not sure. I think there may be, a lot of legal and political things involved, but maybe in the end it will be the Africa CDC that comes up with a qualified body that can do accreditation throughout the continent.
Hello, Fritz. We have another question here, talking about when we consider that how many tests or how many times do we have to run samples on a machine in the laboratory to consider it like validated. I've had this issue with trying to like develop like protocols around validation, preparing equipment for accreditation. Are there like any links or resources that you could point us to for establishing these processes within the lab for validation and things like that in preparation for accreditation? If there are like standards, standard SOPs available already.
Yes, so we develop a lot of the SOPs for accreditation, not for accreditation, for validations, and it really depends on the on the assay. So there are certain I can see one of my colleagues from Zambia, Venon, is mentioning the PSMAL standards. So there is a lot of that. PSMAL gives you tools, not tools for validation, including, so if you look at the PSMAL document, you would see it's specified for, so if you're doing a precision, or you would need at least 20 samples or 20 results for between run and within run. For some of the assays, you need about, for the rapid assays, you need about 60 samples, 30 positive and 30 negative. The chemistry, the different, so yes, there are a lot of resources. The PSMAL resources are free of charge. You can go and just put in the PSMAL. It's at Johns Hopkins University in the US. So you can get those ones. We develop a lot of SOPs for validations as well. But just in terms of numbers, it needs to be statistically significant. You can't run 2 samples and say, I got 100% pass. You need to be able to run a proper statistic to be able to say that this is a pass or a fail. But the PSMILE standards would tell you for chemistry, you need to run precision, and precision you would need to run 5 samples over 4 days to get a between run, and 20 samples within the same day to get a within run. And they will give you a tool where you put the samples in and you put in the manufacturer's CV, and if it passes, so we can share those tools as we connect with everybody, but the PSMILE ones are freely available online. Yeah.
Thank you so much, Fritz. We have a question about scientists undergoing internal audit training. Are there, again, bodies that are assigned to train laboratory scientists to be able to conduct these internal audits?
Yes. Yes. So in South Africa, SANAS runs, I think it's a 5-day course for internal auditors on the two main standards, 17025 and 15189. I think the African Society for Laboratory Medicine is also running an internal audits course. I'm not officially, I don't know, but I do know that these 2 of our colleagues in Ghana are now certified auditors through the ASALM program. But SANAS also runs a course here in South Africa. It'll be quite expensive to move people around, but I've seen colleagues from Tanzania and from Kenya and Zambia come down here for the SANAS course. It's an intensive course. It's really good to do. But I think through ASLM as well, people can get a chance to do an internal audit course.
Yeah, John, so I think there's 2 questions from the chat. I'll just give an attempt to answer that, but Fritz, feel free to add more. So someone is asking if a lab that has different sections, for example, hematology, microbiology, or molecular section, that all the sections have to be ready before they go for accreditation, or you can only go for one section. So I think, yeah, you can go for one section if you think that section is ready. So when the lab is accredited, they always give the accreditation per that section. So for example, hematology might be accredited, but microbiology is not yet accredited. So if you think hematology is ready, so yes, you can go for accreditation. And then the second one, somebody's asking if they can use a checklist as an internal audit. A checklist is good, but I don't think that can be substituted for an internal audit, because with an internal audit, there are more things that you go through and to see if the entire process is being done correctly as it specifies on your QMS. So a checklist is good, but you can't, I don't think you can use that as your internal audit. Yeah, Fritz, thanks.
Yeah, yeah. I think that the second part of the question, it depends on what checklist they're using. So the SLIPTA checklist is freely available. So if you take the SLIPTA checklist, you can use it as for your own internal audits and actually score yourself to see whether when you're actually, so the WHO has really made the process of accreditation simple for us. So yes, you can go for just hematology, but look at the resources and look at the cost of doing the accreditation. So if I'm sitting in a lab in Douala and I have to bring in people from Kenya for accreditation, do I want to do it 3 or 4 times? Or do I want to get ready with the lab and then bring in people? So those are decisions management decisions that need to be made when you have a good system in place. So if you have a good system in place, it will be easy for management to say, okay, we are sitting in Abeokuta in Nigeria and we're going to bring people from England to do this. Should we bring in 2 or 3 times? You can make that decision based, And the second part, don't develop your own checklist to use for internal audits. But if you have, there are freely available checklists like the SLIPTA checklist. There are a lot of them online. PSMILE has got some as well that you can use. I was trained on the P-Smile ones before SLIPTA and the GCLP ones, but if you can take one of them, but it needs to be incorporated in your quality management system in your lab. The checklist cannot be a floating document. If it's not part of your SOP, if it's not part of your system, don't use it. Thanks, Franklin.
Okay, Fritz. Happy to see you. This is Jean-Paul from Cameroon.
Jean-Paul, I think we've met before.
We met in Lambaréné.
We met in Lambaréné, yes. Yes.
Yes. Okay, there is someone, Jose, who is asking a question. At what level can we say a laboratory has met accreditation standard? And there is another question, how can a country transition accreditation activities to the Ministry of Health so that it is sustained when donor support wanes? What kind of advocacy can be done? So that are the two main questions. Can you give an answer on it?
Okay,
please?
Yeah, thank you. Just repeat the first one again.
What level can we say a laboratory has met accreditation standard?
Yeah. So we talked about the SLIPTA program, and the SLIPTA program gives us a star scoring from a 1-star to a 5-star. If you have a 5-star on the SLIPTA program, you have arrived at the accreditation standard. So meeting the standard at 5-star, you're ready to go for accreditation. Go into detail of what the different components of the SLIPTA program is, but for us in Africa, it's really an excellent tool that we can use to prepare us to accreditation. So if we follow the SLIPTA program, we start with our commitment to quality, and we put together all the documents, we put together all the training and the facilities and the organization. If all of that is done, we are meeting the standard and we're ready to go for accreditation. Of course, when the assessors come, there will be findings. It's not, as we say, it's not a point where we arrived and we never go back. It's always a work in progress. Quality is a work in progress. There will be findings, but we'll be ready to progress to accreditation when we're at 5-star. In terms of advocacy and getting this to the government, it is really, I don't know what to say, but there's a saying that health is wealth. If we have a healthy population, we have people who can go out to work and boost our economy. So if we take my country, Cameroon, if people are going to be sick and you don't, then they can't go out and work. So we have to make the case to our government that, number one, the laboratory is a factory that produces results that can be used by the clinicians to get our people to be healthy. But if the laboratory is producing results that are not usable, then it's a waste of government money. I have been to labs in Gabon, in Burkina Faso, where I have seen huge amounts of reagents that have been sitting in the lab expired, not used. That is government money. That is taxpayers' money. We talk about a lot of corruption in our countries, but if you look at it and you see how much wastage government is putting into reagents that are expired or not used, but if we have a quality management system that manages inventory correctly, government will save money. So that is the case we need to make to our governments, that, if you go to England, if you go to America, they have a resource management system that ensures that there's no wastage in the system. And if we can have that in Cameroon, in Gabon, in Kenya, then accreditation saves the government a lot of money, but it gives the people good health to make more money and pay more taxes.
Thank you, Fritz.
Thank you very much.
Just to add on to that, I think we should emphasize to our governments that it's more cost effective to do this before, you know, as like preventative beforehand. It saves money in the long run. Money you spend upfront is more than claimed back over the money you save in efficiency and the way you run your laboratories. If you've got a good inventory system, you're not buying things you don't need, number one. And when you do buy things, you're able to, you know, do buy like equipment or reagents, you're able to use them in a cost-effective manner and save money throughout, you know, systemically throughout your system. So it's a net savings in the long run. So I have a question here, which I will direct to Fritz. Proper documentation alone can affect turnaround time for a test. How can this be minimized, and should this time be considered when setting up a turnaround time per test?
Okay. Yeah, I get the question, but I'm not sure I know. But documentation is the number one thing in our quality management system. So yes, proper documentation can affect the turnaround time for a test. If a sample arrives in our lab without a requisition form, the people who receive the samples are told not to accept it because you don't know what test is being requested. So proper documentation can delay turnaround time. So if a sample comes here and I take the sample and this is the requisition form and this is the sample, when I check the sample does not match, there's information, but the information does not match. Say the PID, the patient identification number, is missing something. I need to send a document to the clinician to say, please correct this information, because we don't want to give the Jean-Paul's results to John. You know, it needs to be, you know, John in French is Jean, but if somebody just mix them up and say, you know, on the requisition form, we don't want to give the wrong result or the right result to the wrong person. So we will, the documents will indeed delay this. So we emphasize there's good documentation practice, which is a small shortcut that people need to learn how to complete these documents and make sure that the documents that we receive in the lab, when the sample comes, the documents match. So yes, it's true that improper documentation might delay turnaround times because we didn't get the correct. I don't know if that's the example the person asking the question is referring to, but those things need to be in place and ensure. So if we're doing an accreditation, we come out and you find out that your requisition forms never match the information on the sample, you know, that's one way of not getting accreditation. Yeah.
If I may just add on the TAT, so it's important for us to understand what the TAT means. There are times that the lab scientist thinks the TAT is just when you get the samples and then you run and you have your results. So the results are sitting on the machine, for example, whatever test you've done, and the results are there, that's the TAT. So that's not the TAT. So when you're defining your TAT, you have to take into consideration when the samples are received, they're verified, they're run, the results are verified, they're signed off, and then when the client is having back the results. So it's not only at that analytic phase that you define your TAT. For example, if it takes you 2 hours to run AAT, that's not the TAT, okay? So the TAT has to be more than 2 hours because you have to consider when you receive the blood sample, before you do all the verification that that's the right sample, you send it to the lab, they analyze that 2 hours. It might take you another an hour or 30 minutes to verify that that result is okay, that the run was okay, and then somebody has to sign it off before you send back the result. So all of that has to be into consideration. So it's not just the 2 hours. So that's the point I wanted to make. Thank you.
Yeah, thanks.
Thank you, Fritz. Thank you, Franklin, sorry. I was just going to add on to what like Franklin said. and I'll give an example of a clinical trial we were running for expert, when expert was being validated. The time to run an expert is 2 hours, basically. But because we had time we had to account for time between the sample, the time the sample is collected, to the time it gets to the lab, to the time the lab tests and produces the result, to the time it gets back to the doctor. That was the turnaround time. So from the time the test is asked for and the sample is taken and sent to the lab, to the time the physician actually sees your results and is able to, make a decision on clinical treatment based on the result that you've given him. That would be your total turnaround time. So you have to consider everything in that. So I don't see any more questions. I don't know if Franklin and Jean-Paul, if you've seen any more questions,
we
can take 1 or 2 more questions, and then we can pass it to Max for the wrap-up.
Yeah, I think there's a question that if repeated like a couple of times, you just Fritz, they want to find out who oversees this accreditation body, like SANAS. Are they higher bodies that do accredit them as well, or cross-check the activities or evaluate the activities?
I don't know. It's one of those questions: who's watching the watchers? Who's watching the police? Or or who's watching the insurance companies? I don't know the answer. But they need to. Well, the standard says it needs to be a qualified body. So I assume that these bodies have the qualification to do this, and they need to have the authority. And I think I don't know. Maybe the government issues them with that authority, or maybe they get it from the from ISO, maybe they do, because the International Organization for Standardization is a group of actual country bodies that come together. So each nation is represented there. So I think that's where they're getting their authority from. But I stand to be corrected. I don't know.
Thank you. Any more questions that you see, Franklin or Jean-Paul, or should I pass this on to Max?
Yeah, I think there is no more question. Just that to thank Fritz for all the response, and then also just what I want to say, I want just to make a small comment. I hope that this workshop should be very, very useful for our country and for our lab, because most of our lab in the hospital, we are not doing quality management system. So, and it's very, very important. And Fritz has underlined that, so that in our lab in Africa, in some countries, we can put something in place in order to do good quality management system, and also go for accreditation. That is very, very important. It's just a small comment on what he has said. Thank you.
Merci beaucoup.
Thank you. Thank you, Jean-Paul. So we'll bring this session to a close, and we'll pass it on. We thank you everyone for the questions. We've actually had like many questions and a lot of engagement, which is good. I'll now pass it over to Mags for closing remarks.